I'm Shauna Bradshaw, Dr. Mom HD, and welcome once again. Today we're going to talk about periods. So since I do look after the entire family, mainly in my practice though, I see moms and I see children. And one thing that comes clear an awful lot in my practice is the fact that women don't know what their periods are supposed to be like or what a normal period is. It's really interesting because once they start taking homeopathics and all of a sudden their hormones balance out and the periods are better, they're floored as to what a period actually is like. So I'm just going to go over some of the things that a normal period should be. And I do put that in quotation because every body is different and everybody has a different way of going through a period. First off, your period should be on day 28, anywhere from day 21 to 28, but normally around day 28 is when you should actually start your first day of bleed. Your period should be a good 3 days of red blood that you basically need to either change a pad or a tampon 3 to 4 times a day that has a good amount of blood in it, not just a scanty amount. You actually are changing it because it's full, not because of hygiene reasons. The other thing that you need to know is that clots are normal. Clots that big, about the size of a loonie or a toonie, no problem. Some women do throw clots and that's okay. But clots the size of your palm is not okay. That's too big. The size of a baseball, too big. That's when you need to be concerned. Okay, so clots do happen in our body and they are okay. The color of the blood should be bright red, not dark brown. Should you spot beforehand? No, you shouldn't. There should be no spotting. It should be a full period. The other thing, should you have PMS, or in Australia they call it premenstrual tension. Kind of like both of them. Anyways, what is PMS? Well, tenderness in the boobs, pain in the stomach, in the abdomen area, pain in the back, irritability, cravings of chocolate or anything else that's going on. Basically, PMS shouldn't even happen. In a normal, well-balanced body, PMS doesn't happen. You don't get headaches, which is probably related to the low iron, so that would be something I'd be looking at. You still get cravings because, I mean, even in a normal body, sometimes that little sugar intake is what you need. You shouldn't have any tenderness in your breast. You shouldn't have any back pain. And in the ovary area where there's pain as the bleed is happening, that shouldn't happen. When you should feel pain, or at least a twinge, like you should actually feel when you're ovulating and when that egg is ready to release, that is when you should feel it. And you should be able to feel it either on your right side or your left side. So that's something that you should consider. The other thing with your period, moodiness, you shouldn't have any of that. It should not be related. So all those things are abnormal things that should be happening. You actually should be able to go through your period pretty happy with a little bit of, inability or a little bit of inconvenience for changing your pads or your tampons. But that's about it. And actually it should be a really good consistent bleed throughout the day too. So that means morning and nighttime. If anything like this is shifting or changing in your body and you're finding that you're getting the PMS symptoms, or you thought that you had a normal period but then you're listening to this and you're going, maybe I don't, get in touch with me. I can definitely help you. I've helped lots of women regulate their periods, regulate their bodies, and I am now able to work on, everybody and help you out with your period. So homeopathics is a wonderful way to balance your body and balance that system, especially with the hormones. And now that I've got a few new techniques up my sleeve, I'm planning on using those in my practice. So I'm Shauna Bradshaw, Dr. Mom HD, saying this Dr. Mom is a mom herself, and she's also out there to help other moms. So join me on Twitter, or follow me on Twitter and join me on Facebook, and I look forward to seeing you and chatting with you again. Take care for now.